Your knowledge, I would like to tell that our knee joint has got three compartments: dakhil or jawwa, kharij or outer side, and patellofemoral or sabun joint. So we have three joints. In knee joints is a complex joint which has got medial compartment, inner compartment, and the outer compartment. In 90% of the patient, it is the medial compartment which gets damaged. And at the same time, the middle compartment or patellofemoral joint and the outer compartment, they are intact. So when we take a decision to change the tabdil mafsal kamil, we not only remove the medial compartment, we take out the normal part also. So that's too much of a surgery, because patient lose all the normal bone, they lose all the normal cartilage, all the ACL, PCL, they are damaged. So it came to my mind that this surgery is being done abroad a lot. Why not to do this? But most of the doctors, they are shying away of this surgery because of the reasons I would like to talk later.